Okay, I'm a nursing officer, currently working at Magongo Dispensary within the Changamwe sub-county. Yeah.
Right. So you're better placed to have a discussion about this.
Yeah, I can share whatever I have.
Right.
Yes.
Very true.
Yeah.
To begin with, it's not the first time we are hearing of this kind of a topic about cervical cancer. And our question will be, yes, it's there and there are people suffering from cervical cancer. What is it? Let's start from there. What exactly is it? Which kind of cancer is this?
Okay, basically we can start by defining what is cancer. And cancer, we say, is abnormal cells in the body, which can start from one part of the body and can spread to other parts of the body and eventually causing death. Cervical cancer, we say the cancer which affects the entrance to the womb from the vagina. In Kiswahili, we do say mlango wa kizazi.
Right.
Yeah.
So it affects the entrance over to the womb?
Yeah.
Right.
Yeah.
How serious is it?
Currently, we say in Kenya is leading death. But the leading one in cases is the breast cancer. But when it comes to death, cervical cancer is the leading cancer in death.
Right.
Of which every day we are losing 9 mothers out of the cervical cancer.
9 mothers?
Yeah.
Die of cervical cancer?
Yes.
Does it mean that those within the medical profession are doing nothing or what?
No, basically what I can say is like the community. They have not been informed. They have no knowledge more about what they are supposed to do to prevent it.
Right.
But today we are here to share some of the things which they should know and take precautions about it.
Right.
Yeah.
When you're mentioning to me, Madam Esther, that 9 mothers are dying as a result of cervical cancer, and I, from my own look, I see this is not the first time we are hearing about this, and we've had a lot of interventions by government to try and help out this situation, and still we are saying 9 mothers are dying. To me, I feel this is a battle that we are not winning. Is it true?
No, we are going to win, because we have the target. By the Vision 2030, there are some of the strategies the government have put up. We are going to implement and see how far we can reach. Because we are targeting by the 2030, we should be free from cancer of the cervix.
Right.
That is, if the community, they are going to embrace whatever the strategy
Can we
the
get there, where we'll have 0 cases of cervical cancer?
Yeah. Until the time the community, we are going to embrace the strategies,
right,
of which they are very simple to implement.
Very true.
Yeah.
You'll have to explain to me the strategies later on in discussions about how we get ourselves to know more about cervical cancer.
Yeah.
But, so much has been said about the cancer in itself, generally cancer. People have accused cancer to be maybe a curse or something, and we fail to understand, and those, if within you who are working within the profession of health, you can help us understand more about these issues. There is this perception about people feeling that cancer is like a curse or something, and we fail to understand where does it even come from, and these kind of concerns from people, do you feel are the ones which are making us to forget and taking precautions about doing away with cancer?
Okay, some people do say it's a curse, but actually it's not a curse. There's a causative organism for that. Today we are talking of the cancer of the cervix.
Right.
And whatever caused the cancer of the cervix is the human papilloma virus itself. Yeah, so it's a virus which causes the cervical cancer. It's not a curse.
Where do we find that virus?
That virus is within us. It's the moment you start having sex, that virus will get it.
Right.
It's transmitted through it's a sexually transmitted virus, yeah.
Right.
Although it can also be transmitted through the skin. But the major point where it's transmitted is the vaginal, through sex.
Right.
Yeah.
And when we are mentioning about cervical cancer, if a patient comes out and tells people that I'm suffering from cervical cancer, people have this perception, like for instance, people think he or she goes around having sex with everyone. Is that the case?
No, it's not the case. Because we say it's a sexual transmitted disease, of which there is 2-way. It's like HIV. You can be faithful to your partner. Mostly men, they transmit to us. You can be faithful to your husband,
You're
But
now pinning it for the men.
yeah, men, they're the one who brings the cervical cancer,
Right.
the HPV. You see? So you can be faithful to your husband, but still by the end of the day, you get the cancer.
Right.
Because it's a sexually transmitted disease. Your husband can have multiple partners. As you are saying, one of the causes of cervical cancer is if you have multiple partners,
Right.
sex partners, like the HIV. Your husband moved from one lady to another without using protection. I'm sure if one of the ladies have the HPV virus with her, eventually you are going to get it to your wife. Yeah. Yeah.
Right. And the chain continues.
Yeah, and the chain continues. Yeah.
Quite sad.
Yeah.
And also looking at, you've mentioned here about men, and to me I feel also men have a key role to play in the fight against cervical cancer, of which you'll explain to me later. And looking at how this is being transmitted, and talking about the human papilloma virus in itself. There has been a lot of concern about this vaccine called HPV. I know you've heard of it.
Yeah.
And if we get to understand, because the fact that you've mentioned HPV, let's talk about it a little bit, and its vaccine. How does it operate in the body?
Okay, with HPV vaccine, it's not a live vaccine like any other vaccine like the measles and the BCG. HPV vaccine itself is like antibody being introduced to your body to fight against the virus. Yeah. And it's being given to girls between the age of 10 to 15 years. With that age bracket, we assume that they have not started having sex. Because immediately you give them, as in you create the antibodies in their body in such a way, in future, when they start having the sex, they are safe.
They are safe.
Yeah, the body has the antibody to fight the virus. Yeah.
So it's strictly between the ages of girls?
10 to 15 years. We assume they have not started having sex. Although they are saying it can be given to women who have already engaged in sex. But the protection, we say, is about 40 to 44%.
Right. I was coming there. Can it be administered to grown-up women?
Yeah, it can. The study has shown it can be given, but the protection is not like the young girls who have not started the sex.
Okay.
For big ladies who have started having sex, the percentage is 40 to 44.
Right.
Yeah.
We have our mothers and our fathers out there who are watching, and they have had a lot of, different thoughts about the HPV virus, HPV vaccine in itself.
Yeah.
And they feel to some extent that they do not want to allow their girls to go and get that vaccine.
Yeah.
Is that a concern to you? Have you ever heard of such cases?
Yeah, currently we are doing it within Changamwe. Is an RRI going on, Rapid Response Initiative, the whole of Kenya. We are trying to target by the 15th of February. We should have reached all the girls.
Right.
But actually we are getting some resistance. Let me speak about the Magongo dispensary.
Right.
We are working within the Changamwe sub-county, Changamwe ward and Hpv ward. Actually, we have received some of the resistance from the parents. Some they are refusing.
Right.
But majority, they have tried to accept after giving them the health talk.
And for those whom are resisting, what kind of reasons are they given?
They are talking of is a family planning method. We are trying to give the girls. In future, they are not going to give birth. Yeah.
Of which, is it true or it's a rumor?
Is a rumor.
Tried and tested, rumor.
Is a rumor, that one.
So there is no any sort of aspect of, issues about family planning?
No.
At all?
There is no issue of family planning, yes.
Is there any relation between the vaccine and issues about fertility?
No, there's no any issue between the vaccine and the fertility.
Right. And then do you think your explanations that you give to the person who has brought the girl at the dispensary, how do they perceive it? Do they embrace the information and say, okay, just administer the vaccine, or they are still resistant?
Majority, they're embracing the explanation, yeah. That's why we are saying, as per the Magongo dispensary, we have been given the target of 1,302 girls to get vaccinated by 15th of February this year. And actually we are at around 1,000, meaning only around 300 girls, we are yet to reach them, of which I'm sure we are going to reach them.
And if we have our mothers watching and they have daughters at the age at which you're talking about here, and they feel, no, I'm not yet convinced that this has nothing to do with family planning, and even though I'm hearing rumors about this, how can you, and what can you tell such mothers?
What I can tell them, out of the study, I think is everywhere in the media, the Hpv vaccination, the cancer of the cervix is everywhere. Day nights, people are talking about it. What I can tell the mothers, they should embrace the vaccine. The moment the government, they have come up to the vaccine, they have seen the burden of the cervical cancer in Kenya. If you can lose 9 mothers per day, that's a burden to us, Kenya. And what we know, the cervical cancer is preventable. Now the government have put effort to come up with so many strategies, giving such a vaccine free of charge. When you go to private hospitals, it's costly, I know that. But the government, they come with it free of charge to assist the common 190 who is not able to get the money to go to private setup. So what I can tell the mothers, just embrace the vaccine, and in future you are not going to regret about it.
Right.
Yeah.
Very true. And also, we will be talking more about the prevention measures in relation to dealing with cervical cancer. But I want to come back to talking about if today I get into a dispensary in a hospital and I'm being diagnosed with cervical cancer. Before I even get to go into the real diagnosis of it, do I have to see things that can tell me and make me think that to some extent I may be having cervical cancer?
Okay, that's good. With the cervical cancer, what we say, it has no signs and symptoms when it starts. The moment you start seeing the signs and symptoms is the advanced stage of the cancer.
Right.
So it's asymptomatic. It's so silent that in such a way you can't tell until you are done the screening. That's when it can be told the lesion starting.
So you mean a lady can be walking around with cervical cancer?
Yeah, exactly.
And herself does not know that she's suffering from
Yes,
it?
exactly. Yeah.
Getting back to you, Madam Esther, you've mentioned to me that, yes, once you begin to see the signs and symptoms within which cancer, the cervical cancer operates, then it tells you that you are in an advanced stage.
Yeah.
And now, if I get to that point, where do I start from?
When you come to the real cancer disease, obviously there are 3 types of treatment you can get. One, we call them chemotherapy, where the drugs they are used. There's radiotherapy, where we talk of kuchoma, the seed of kuchoma. And the third one is surgery.
Right.
In case it's the advanced stage of the cervical cancer, this is whereby we see the whole of the uterus being removed, just to save that mother.
Completely?
Yeah, that's the surgery part of it.
Right.
Yeah.
And once we remove the uterus, no more having kids?
Yeah, no more having kids. It's not a guarantee that you are cured from the cancer. As you said from the beginning, the cancer cells can move from one part of the body to other part. You might remove the whole of the uterus, but you never know. Maybe even the other part of the body, they have already the cells with them.
Good.
Yeah.
Now, if Madam, we don't want to get ourselves into that advanced stage, how do we get to prevent ourselves now?
Okay, as I started saying, the government, they have come up with different strategy to fight the cancer of the cervix.
Right.
One of them being vaccination of the girls, as I said, 10 to 15 years, of which every girl gets the vaccines in 2 doses. You get the first dose, then after 6 months, you get the second dose. The second one, we said is a sexually transmitted disease. So we say safe sex practice. And then in safe sex practice, we have the codes which are used. We say A, B, C, D. A stands for abstinence.
Right.
For the young girls who have not started sex, they're supposed to abstain from sex. Completely. B stands for be faithful. For the married men and women, we said a man can move HPV from another woman to his wife. So we advocate being faithful to you, to your wife, or to one partner.
Right.
C, we say condom use. You can protect yourself from HPV by using the condom.
Right.
And the D, we say you avoid the getting involved in sex habit at the early stage.
Early stage.
Yeah.
Right. So, in a nutshell, you're also telling me that our young girls and our young adults who are still growing up, they should also know about this information so as they can also prevent themselves as early as possible.
Yeah, yeah.
Right. And
For the women like us, the way we are going to prevent ourselves is by having our pap smear, our cervical cancer screening being done every time is needed.
Right.
Yeah, and the fourth one, you can have the health education to the community. Like now, they are not taking up with the cervical cancer screening. Some they have the bad information about the Hpv vaccination, as you had said.
Right.
So we need to help educate the community about them. Yeah.
Right. I was coming to the PAP there that you've just mentioned, and it's quite another matter that has been quite of concern also, talking about how our women do not even care about getting into going to have this kind of screening. How important is it?
As I said, screening is one of the ways which will assist us, like the medics, to know your status of the cervix. When we screen you, we get to see the lesions. The lesions are the one who will advance later to be the cancer of the cervix.
Right.
When you get the lesions, covering maybe less than 75% of their cervix, there are some of the treatment we give immediately. Nowadays is you screen and you treat immediately. We have one called thermoablation. Thermoablation, we use a heated metal probe and we burn the cells, the lesions themselves. We have cryotherapy. Cryotherapy is a sort of a gas spray. Right. It's very cold. Then the moment you see the lesion covering the cervix, you spray to the lesions, then you paralyze them, and they don't continue multiplying. And now the mother becomes safe. Maybe the lesion they are covering more than 75, the whole of the cervix, we go for the surgery method, which is LEAP. That one is done by the gynecologist. Yeah. And
talking about the cancer screening, and where can we find this kind of screening here around Mombasa?
Okay. With the cancer screening, it's been done everywhere, all the facilities, especially the geocade facility. Even currently, we are in the month of the cervical cancer.
True.
We are very aggressive in doing that. All the facilities nowadays, we are very busy screening the mother every day. So I can urge the mothers who listen to me out there, just visiting the geocade facility, and you are going to get the service free of charge.
Right.
Yeah.
You know, when you're mentioning about our mothers, I'm beginning to see this on a different angle. Like, you know, a mother waking up and saying, you know, today I want to go and do some screening to my body. It's quite, they feel odd and they feel like, you know, I'm not sick, why should I even go there? Yeah. Should we wait for us to feel something in our body for us to go for the screening, or we should just wake up and go?
We should just wake up and go.
Right.
Yeah. We are just saying, we are doing it for the HIV negative mothers. We are doing it after every year. For HIV positive mothers, it's after every year due to the immunity of the HIV.
Right. And talking about the machines at which you use for screening, other mothers feel that they are not much healthy to them, and they have also read some bit of rumors and myths and consumption about screening itself. Is it a concern to you that also screening is part and parcel of the much faulty information that we are having out here?
Yeah, so many mothers, they come scared, saying there's a certain machine, metallic one, so many rumors about it. It's so painful, but what I can tell them, being one of them, I've undergone the procedure, it's not painful. It's that the mentality they create, but it's not a painful procedure. It's not a discomfort one. You won't get any discomfort from the procedure. Right. Yeah.
I don't know what is it, but within the medical field, you get your correct and your verified information must be, you know, be interfered with, and there is so much information, faulty one, across social media. How do you guys get to counter that?
About the false information for the media. Okay, as the government, we are seeing in the television everywhere, they're coming up with the right information, advertisement in the media.
Right.
Day, night, the government, they are trying to clear the doubt to the community.
Right.
Yeah.
So we should pick in on whatever the government and the Ministry of Health is talking about.
Yeah, the moment you see the Ministry of Government brings anything to you, to the community, is a safe thing to the community.
Right.
Yeah.
I do. And also, now, when we are mentioning about cervical cancer and the entire process of treatment and prevention, most people say this is quite costly and it's very expensive for the local mwananchi. And I know you as a mother and in your capacity as a nurse, What can you tell us about this cost of treating cervical cancer?
As any other cancer, we know treating cancer is very much expensive. And nowadays you can hear people saying it's much better I get HIV than cancer. Because actually the cost is so high for the treatment. Going for chemotherapy now and then, radiation, surgery now and then, and something maybe you're going to go with it for some years. You see, it's so expensive. Going to Kenyatta Hospital now and then, that transport, coming back, going maybe twice in a week, so expensive to treat the cancer. And that's why I advocate for prevention is better. Yeah.
And of course, I want to understand you now. I want you to take away the nursing part of you, and let's focus on you being a mother.
Yeah.
I know this is quite hard if today we find a mother being diagnosed with any sort of cancer, particularly mentioning about cervical cancer.
Yeah.
How hard can it hit this kind of mother? What can go through the mind of the mother knowing that, I've got cervical cancer?
Yeah, sometimes it's so traumatizing. Like at the moment you just mentioned the word cancer itself, it's so traumatizing.
Right.
Not only even the cancer, even after screening those mothers, you get some abnormal lesions like the one I'm talking of. The moment you mention to that mother, you see them, they change. So they have to undergo some counseling to accept the whole thing, whatever you're talking about. Meaning the lesion is not the real cancer. So it takes time for them to accept that situation.
Right.
Here comes the idea of just breaking the news to the mother, now you have the cancer. It's so traumatizing.
Very traumatizing.
Yeah.
And very difficult.
Yeah.
In fact, especially if it were me, you telling me, go and tell somebody he or she has cancer, I'll lack the words of how I can explain that to them.
Yeah.
But of course, it's your profession and you know how you do it.
Yeah.
Right. And also, do you feel the mothers in Kenya have been taken good care of by the government in matters about cancer?
Yeah, 100% I can say.
Right.
If the government, they are able to give us the vaccines, to give free of charge to the girls, the government is able to provide us with the necessary, as the speculums, the logos, and all the things which are needed for the screen for these mothers. We can say they're doing a good job.
They're doing a good job.
Yeah.
Right. And in as much as the government is doing a good job, and we are still getting cases of cervical cancer increasing, and the deaths continue to increase, despite the much effort that the government is putting. And you've mentioned to me that it's upon the mothers to also embrace some of these interventions.
Yeah.
Where do we see ourselves in the near future in battling cancer?
Okay, currently we are saying if you don't take care by the 2030, the government, they had the strategy. By 2030, we should be free from the cervical cancer. But as the current situation, the way we are seeing things going, by 2030, there will be a rise of 30% of the cervical cancer. And that's why the government, if we are not careful, if we don't implement whatever they are talking, because they had come with the target of 90, 70, 90. 90% they are talking of all the girls between the age of 10 to 15 years should be fully immunized against the HPV virus. And the 70% is talking of all the women of reproductive age should have been receiving the screening of the cervical cancer. And the 91 is talking of all the mothers diagnosed of the cancer of the cervix should have received the treatment. Or the 90% of the mothers with the lesions should have been treated of the lesions. That's the government have put into place. But if you don't take care, as the current situation, the way we are seeing the things, in 2030, there will be a rise of 30% of the cervical cancers instead of declining.
Right.
Yeah.
Are you sure this kind of information that you're giving me, our mothers know what we are talking about here? Do you give them this kind of information when they come to visit?
Yes. Every day at our place, at our facility, in the morning we have the health talk. We talk to them every day. Every day we talk to them. Some they will accept. They come to us, we do the screening. But some will say it's painful, but we are not giving up. We are still going on and trying to give the right information.
Right.
Yeah.
Very true. Now, I've got quite a number of questions that our viewers had asked earlier when we put this up on our social media, and I need to touch a little bit concerning them, those which you can as well give answers to. And there is one question that can treatment of cervical cancer cause early menopause?
Cervical cancer? No, with that one, I don't think so. Yeah.
So there's no way it causes early menopause?
Yeah, no.
Because women feel to some extent, I might undergo the cancer treatment, cervical cancer treatment, and at the end of the day, I might get an early menopause despite maybe I'm at my 30s and 40s.
No, that one, I don't think so.
Right.
Yeah.
Good. And another question is, at what age should our girls and our ladies begin visiting gynecologists?
About what exactly? Gynecologists for which checkup?
Whichever the case.
Whichever the case. That one is broad. Maybe CGU.
Should we advise our young girls to be visiting gynecologists? Do you see any necessity to that? Ni lazima
No, what I think, the girl should start seeing the gynecology when you start being active on sex. Yeah.
That's where you begin going to visit our
because the moment you start the sex, so many problems start from there. But you see, before you start the sex, they are safe. That's why you are saying you give the HPV before they start having sex. Right. Because at that age, we know they are naive when it comes to sex. They know nothing about sex. Yes.
So it has nothing to do with years?
No.
Okay. But of course, people are saying that our young girls and the boys, they normally engage into matters about sex so early. Don't you think it's quite of relevance to also advise them to go and visit?
Yeah, based on whatever the point you are raising up, yeah, it's advisable.
Right.
Yeah.
Of course. And also, somebody asked here, what can be done to relieve side effects as a result of treatment of cervical cancer? You had mentioned to me, yes, cancer can come with a number of side effects, especially during treatment, of which it may be so much complex in whatever we are discussing here. But there is that fear, generally, listening to some of these questions that our people have been raising, there is that general fear that people feel about getting to go for the cancer screening and the treatment in itself. So they just leave and say, let what may come, and they leave it to God. Is there any danger of saying, let me just wait and see what happens to me?
Yeah, exactly. Those are the people when it comes to cancer itself. They are now with the cancer itself. They start regretting. Right. I wish I knew. Right. When you talk to that person, I say, I wish I went for that screening. So instead of waiting for that moment to start saying, I wish I knew, I wish I knew, I just advise them, don't assume the things. Right. Just visit the health facility, let the screen be done, and you'll be safe to go. Yeah. Right.
And before even we finish up, there is this aspect of that you mentioned to me earlier on. You were mentioning to me that Magongo Dispensary is one of the few dispensaries within Mombasa County that is doing well in terms of dealing with cervical cancer and some of the interventions, talking about how you give out the HPV vaccines. How are you doing it out there at your dispensary, and how good are you?
Okay, when it comes to HPV vaccination, what we are doing, you have our officers, we call them CHU, Community Health Extension Worker. They are part and parcel of the team we are working with. Right. They go to schools, they inform the teachers. The teacher give the letters to the people. They take them to the parents, request for the kids to be vaccinated. They come back with their letters. Whoever have given, go ahead, we do it. We give the vaccine, yeah. Right. Then you go to school and do it, yeah.
And the different schools around Magongo here, how have they received that idea?
I can say 99% of them, they are positive about it.
Positive about it?
Yeah, and that's why we are able to reach so many girls within the shortage period given. Yeah.
And what are some of the few goals that you want to, in line of whatever you're doing, what do you want to see in the near future, especially here in Magongo area?
In Magongo area, what we want to see, I can adopt the government strategy, what they want to put in place. We want to ensure all the girls between the 10 to 15 years, they have received the vaccination. And we want to assure that the women within us, within the Magongo catchment area, they are being screened of cervical cancer. Right. We are even extending our services to the nearby APZ. We are going to screen those mothers. They have no time to come to us due to the working hours. So as Magongo Dispensary, what we have done, we are going to the facility, we are going to them, doing it in their working places.
Okay.
Yeah.
It sounds to me like the screening process is not that complex and technical.
No.
That needs you to visit the facility?
No.
Okay.
You just need maybe an examination coach and privacy. Only that.
Privacy.
We have our own things. We just do it there.
Okay.
Yeah.
Right. True. So, for instance, maybe you've gone to such a place like the EPZ and you find, so you do some screening. Does the results come immediately?
Yeah, with the screen of the cervical cancer, you get the results immediately. That's why I said it's diagnosing and treating nowadays.
So if we've diagnosed and we find out that, let's say, Lady A is she has shown signs of having cervical cancer, you begin the treatment from there.
Yeah, yeah.
Right.
We have the gadget with us. Yes.
And the earlier the better.
The earlier the better. That's why you are saying is, you visit, you diagnose, you treat immediately the client. Don't leave that client to walk away from you. You never know. The moment she walks away from you, maybe she won't come back to you.
Right.
And you are going to put her at risk of cancer.
Very true. So that's good stuff that you're doing at Magongo Dispensary. And also, when we are talking about the different hospitals that we are having in Mombasa County that handle this matter, people also feel to some extent they may not know this kind of information just because you've put it up. You've mentioned to me that all government health centers do the screening free of charge?
Yes.
Absolutely?
Yes.
So many people as much as they do?
Yes, I think they should do so. Right. They should bring it in advert every day. If I can say maybe from January to December, they should not get tired of it. Not that we are seeing is a big burden to Kenya. I think something should be done about it.
Good. Yes. And also, as we finish up, this is a month at which we are doing matters about cervical cancer awareness.
Yeah.
And what are some of the few programs that you are trying to put in place in talking about cervical cancer?
Okay, as today, as Mombasa County, there's commemoration of the cervical cancer, which is ongoing at Kongoea ground as we speak right now here. Also, as
today?
Today there's commemoration of the cervical cancer at Kongoea ground, which is going on. Yes.
Right. So, in entirety, what is happening there? There is cancer screening, or? Yeah,
obvious. When you go to such activity, there must be cancer screening being done.
Right.
Yes.
Good. And also, there are those of us who are watching, and we've seen quite a number of organizations that have come into place talking about cervical cancer, especially how they seek to help women realize and getting to know their health in terms of the way their body works. What can you comment about the different people, organizations, entities that have come together to hold hands with the government in putting efforts and emphasis about cervical cancer?
Okay, first I would appreciate Stawisha Pwani. Actually, they are doing a good job. They are just new in the field.
Stawisha Pwani?
Stawisha Pwani, yes. They are doing a good job to us. They are just coming to the service recently. They have not said, but actually I can say they are doing a good job. Currently, as we talk, we are doing an RRI, Rapid Resort Initiative on cervical cancer screening, both for the HIV negative patient and the positive patient. And actually, they are giving us a very good support on that. So we can see they have that passion of working with us.
Right.
Yes.
Good. Last but not least, I want to give you an opportunity to speak to the mothers. If you can choose to use Swahili or English, it will depend with you. But we need the mama out there to get to listen and to know how serious cervical cancer is and the importance of screening and the HPV. In a minute, what can you tell me?
Okay, maybe I can talk in English and that one in Kiswahili. Maybe there's somebody somewhere watching and maybe they're not getting in English.
Right.
What I can start saying in English, we are saying cervical cancer is preventable. And we are saying one of them, we have talked of Hpv vaccination. Mothers, I just request you, let your girls be vaccinated against this HPV. Now with that, we are seeing is a burden to Kenya. It's killing 9 mothers in a day. Let us get them vaccinated and protect our girls in future. Secondly, we say the safe sex practice. As we are already started having sex, let us practice safe sex to prevent the cervical cancer. Then to all the mothers, just as I request you, make sure that you have been screened against the cervical cancer, we get to know our status of the cervix and get the treatment as early as possible. Then to get the seriousness of the health education which we do give you, both in the facility, television, whenever you get the information about the cancer, the cervical cancer, just take it serious and put into place whatever you are supposed to do. Na kwa wale wamama wenye waelewi Kiswahili, Kizungu, pengine pongezungumza kwa Kiswahili. Nasema tuache watoto wetu wa umri wa miaka 10 hadi 15 wapate chanjo yao, ambapo zinazungushwa kwa mashule zetu zote. Kisha tunasema tunapofanya tendo la ngono, tujaribu tuweke maanani, tusije tukajihatarisha, tukajiweka katika hali za kuhatarisha katika njia za mapenzi. Kisha nasema ya tatu, tuhakikishe kila mwanamke mwenye anafaa kuangaliwa hali yake ya kizazi, utembelee kwenye kituo chetu cha afya na ujue hali yako ya mlango wa kizazi ya kansa iko vipi. Kisha ya 4 nasema yale mafunzo tunayopatiwa katika hospitali, tunaona kwenye matelevisheni kuhusu hii kansa ya kizazi, tuyatilie maanani na tuokoe maisha yetu. Asanteni.
Right. Asanteni sana. And also we do appreciate you, Madam, for coming through.
Thank
we
you.
are so glad for the few minutes that you've spent with us talking about cervical cancer.
Thank
and
you.
we are also grateful at the efforts at which you're putting, you yourself and your institution in talking about these issues and helping out our mothers. And we are grateful as well. We will continue to partner and talking more about these issues. All right?
Thank you.
Thank you.